Thank you very much for that introduction. I have 20 minutes and I'm going to try and talk about COVID-19, breastfeeding, and where mothers can get more information if they need it. So really thinking about some research we did last year during the first lockdown around how we can better support parents going forward with feeding their babies through the pandemic and anything that might happen in the future. So we know right from the start of this pandemic, there was a major impact on mothers and babies. There were so many headlines coming out that necessarily rules around lockdown and social distancing really started to affect this group. There were restrictions made around face-to-face appointments, who could visit a hospital, who was considered a visitor to their own baby. And right at the very start, there were these awful cases of mothers and babies being separated right after birth because there were worries about mothers having symptoms of COVID and passing COVID onto their baby. We since learned in the coming months that actually babies, thankfully, weren't particularly at high risk, and that keeping mother and baby together was always going to be a much better solution. One of the big things that got missed at the beginning of the pandemic was the fact that breastfeeding would actually be protective in helping babies if they were exposed to COVID in some way. There were these policies, particularly in the US, and this was being shared on social media a lot, which was increasing fear around whether babies would be catching COVID, when actually future research then started showing that if a mother was exposed to COVID, she would start to produce antibodies in her milk, which could then be passed to her baby. This is just a very interesting paper. It's open access. I would suggest you go and have a look at it after today. Really just talked about this issue of making sure that whatever happens, we need to make sure that mother and baby can stay together as much as possible. So that's for breastfeeding mothers, but for all mothers. There are a number of very distressing cases in the UK and in other countries of mothers, for example, being classed as a visitor to their own baby in neonatal care, rather than being considered a dyad who shouldn't be separated. So this is just some of the background context to what was happening. We started seeing headlines such as these, leading to all sorts of unintended consequences. So there were cases of mothers wanting to try and give birth outside the system because they were so scared of being separated from their partner. There were instances of even asking for elective cesareans because then they knew when it would be happening, so they could make sure that their partner was there. And there was just all this knock-on impact in terms of the well-being and health of mother and baby, but also how it started to impact things like breastfeeding. Just as a point here to stress, this is from the Breastfeeding Network. I've put the website address across the top, just to remind everybody, because there's still misinformation spreading, that although there was some discussion right at the start around the safety of the COVID vaccine and whether breastfeeding women could have the vaccine, everybody has now agreed that it's fine for women to be vaccinated. If you go to the Breastfeeding Network, if you're unsure or trying to make the decision around that, they've got lots of different research papers and statements that can give you some background reading for making your own decision there. But it is absolutely fine to have the vaccine. No one should be telling you that you shouldn't have it just based on currently breastfeeding your baby. There is also evidence that is starting to emerge that quite possibly when mothers are vaccinated against COVID, they start to pass on some antibodies to their baby. And the whole area is going to lead to a lot of very interesting research that is going to show just how protective breastfeeding will have been through all of this. However, we know that this has had a really significant impact upon mothers and babies. This is a paper that came out a few months ago looking at maternal postnatal mental health. And this is absolutely unsurprising to me in that we know that the postnatal period is a common time for mothers to start experience symptoms of depression and anxiety. We usually put that figure at around 15 to 20%, maybe a little bit higher, because some parents don't feel comfortable in talking about how they feel and think they might have to hide their symptoms when there is absolutely so much support out there for you if you need it. but this study was actually showing that 43% of women were showing symptoms of post-traumatic stress after giving birth during the pandemic, and 44% had significant symptoms of postnatal depression. It's absolutely unsurprising to me the impact this has had upon new families. The stresses of giving birth during the pandemic, and then the systems that had to be put in place on a wider level of trying to reduce the spread of the virus, and how that all then impacted upon parents and families. Very interesting report. If you haven't seen it, is definitely to go and have a look at the Babies in Lockdown reports. Now, this looked at the experience of parents who had had a baby during lockdown, and it looked broadly at their experiences of parenting. It also included some information about breastfeeding and the experiences parents had had there. And in this report, it very much echoes what we found in our own research. So I'm going to suggest you go and have a look at this report again, tomorrow or later on. But it feeds very nicely into the research that we published last autumn now around parents' experiences of trying to breastfeed during COVID-19. And what was so interesting to us was the very different experiences that parents were having. So we essentially had one group of parents who felt almost protected by the pandemic. They had a much better experience in part because they had more time at home, because they felt less pressure to go out and about. But actually, we then had a whole other group of parents who really struggled and have had lasting difficulties with breastfeeding, either feeling that they needed to stop before they were ready, or struggling through those months of trying to feed without being able to get the support that they needed. So just presenting some of the findings from this paper. So we included 1,019 mothers in the UK with a baby 0 to 6 months old who were breastfed at least once during the first UK lockdown. And just in terms of the mothers who took part, we had 58% who were breastfeeding exclusively at that time. We had 22% mixed feeding and nearly 19% who had stopped breastfeeding. What was interesting to us was that unfortunately, when mothers had stopped breastfeeding or introduced formula, it happened very quickly. And it was usually not when they were ready to do so. So the average age of starting formula was basically around 2.5 weeks. And the average age of stopping breastfeeding was just 3 weeks. And looking at whether that was actually planned or not, we did again see a range of experiences. But of those mothers who had stopped breastfeeding, 13% described themselves as ready, which is good, happy they've made their decision. 4% stopped around the time they had planned. However, 64% had planned to breastfeed for longer, which is a huge number. So those mothers weren't planning to stop breastfeeding so early. They were encountering all these different problems, which they felt led to their decision to have to stop. However, on the flip side of that, almost 20% breastfed for longer than planned. And it seemed really to be this mix of experiences where, although the impact of the pandemic was devastating in terms of breastfeeding experiences for some mothers, for others, it actually gave them the support and time they needed to breastfeed for longer. In part, this was discussions around how breastfeeding might help protect babies. It was being able to access some of the great support that was online, and it was that time for themselves to be able to sit and take the time that they needed to feed without interference from others. Of those who'd introduced formula, 68% had never intended to do so. So it was introducing formula alongside breast milk because they were having troubles with supply and couldn't get the support they needed. 13% had planned to, but they introduced it earlier. And then you have that very small number again, but an important number, who actually ended up breastfeeding exclusively for longer than intended because, again, of some of the positives of the pandemic. In terms of looking at why mothers stop breastfeeding, it was the usual unfortunate story of all the different challenges they experienced. So when we asked them why, they had the usual problems of experiences in pain, worrying about milk supply, not being able to get professional support, the attitude of family and friends around them. All of the usual suspects as such did play a role in leading mothers to stop breastfeeding before they were ready. But when we asked them directly, 70% felt that the lack of face-to-face support during lockdown attributed to this. So that was face-to-face support from health professionals, but also peer supporters, friends who are going to be supportive of breastfeeding, anybody who would have been able to help them with that. unfortunately, 20% worried about the safety of breastfeeding. So 20% were worried that breastfeeding would somehow pass COVID on to their baby. This was particularly true amongst mothers who were breastfeeding right at the start of the pandemic. A lot of stories were spreading on social media that breastfeeding could in some way be dangerous, that you could pass on COVID, when actually the research, as we suspected, started showing that actually no, you would be able to pass on antibodies rather than COVID itself. And 6.5% actually stopped breastfeeding because they had symptoms of COVID. And back then it wasn't because they'd necessarily been diagnosed, because we weren't testing so widely, but because they had a symptom and they were told it could be COVID, so they stopped breastfeeding because of worries about passing it on to their baby. We know that sadly, if they had developed COVID, then their baby would have most likely have developed it as well at that stage. Within that though, just skipping down a little bit, 4.3% were actually told by a health professional that breastfeeding might not be safe if they had symptoms of COVID. And 3% were told they wouldn't be allowed to breastfeed if they had symptoms. So they were still receiving misinformation for health professionals at that point. And thankfully, it was such a small percentage, but even with a sample of 1,200 mothers, that's still going to add up to quite a high number. Worryingly, 31% did not contact a health professional when they needed due to the pandemic. They were worried about pressures on the NHS. They were seeing stories in the news that said that the entire NHS was on its knees, so they assumed that their health professional wouldn't have the time to see them, or they were worried about having to go to a face-to-face appointment and catching COVID. One of the saddest statistics for us in this whole report was the one down the bottom. So 19.4% of mothers with a baby in neonatal care had visits restricted. 80% who had visits restricted stopped breastfeeding in the first few weeks, compared to just 10% who didn't. And that impact of separating mother and baby, that impact of seeing mother and baby as separate, as mothers being a visitor somehow to their baby, really had a devastating impact in so many ways. Keep clicking the wrong one. So challenges in terms of accessing breastfeeding support in particular. So of those who needed support, 43% contacted a health professional and 42% a breastfeeding organisation. Now, those are the ones who got the support. Obviously, those who didn't contact them didn't get the support that they needed. And in terms of not accessing support, it was things like not knowing the support was available, only wanting face-to-face support, not wanting to burden the system, a perception that support would not be high quality, a lack of technology, a poor internet connection. And this is something I'm going to draw out in some of the mothers' quotes I'm going to introduce you to now. But it really was this divide between not wanting to bother anybody and being worried about putting pressure on the system, and then not being able to contact anybody because they were worried about not being able to find that support via video connection because they didn't have all the strong Wi-Fi connection that they needed. So in terms of actually thinking about this in positive experiences, 41% did feel lockdown had a positive experience for them. And this was the group of mothers who really were protected by it. So they had fewer visitors, more time to focus on breastfeeding, more privacy, and tended to have a partner who was furloughed at home or working from home, who was really positive about breastfeeding, so they could create this really supportive environment for them. And just giving you a couple of these quotes, I was inundated with visitors with my first child and often could not feed responsively due to their discomfort with feeding or them wanting to comfort my daughter when she was upset. She had poor growth and I felt enormous pressure from my in-laws in particular to supplement with formula. With my second child, there's none of that pressure and I can really see an enormous difference both in his feeding and my mental health. And another, I found breastfeeding quite difficult due to problems with latching, nipple tears, bleeding and lots of pain. Being able to stay home and concentrate on getting the feeding right is the only reason I persisted. If I'd have lots of visitors or pressures to meet other mums, family or friends, I'm not sure I'd have managed, as I've only just got the hang of feeding 5 weeks in. And not being able to go out has allowed me to gain more confidence in breastfeeding. I still do not feel confident enough to feed in public and feel I need support with positioning to be able to do this. Not having lots of visitors also has allowed me to be able to feed how it works for us without having to worry about people coming round. So these mothers almost had the experience that we talk about a lot, where in other cultures where mothers have that time to rest and recover after birth, and they have helpful people, usually their partner, around them supporting them. And they did have this protective time, which just really let them get on with breastfeeding and getting to grips with it. Mothers talked about sitting around the house with their top off all day, just not having to worry about visitors turning up and disrupting that. Unfortunately, we know that a lot of mothers then had a more challenging experience. So 27% described their overall experience as negative. Unsurprisingly, 82% of those who stopped breastfeeding described it as negative. And for them, it was almost the opposite of that positive experience that mothers were having. So the lack of face-to-face support, less social and emotional support from people who would have come to them usually after the birth, the stress of caring for others, the intense focus on breastfeeding. So whereas some mothers found it really useful just to be at home concentrating on breastfeeding and to grips with it, for others it was just too much. They couldn't have that intensity and found it really challenging. So just some of their quotes. We're unable to have face-to-face support to help me to feed my baby who is struggling to gain weight due to possible tongue tie, which is unable to be treated. Because of the pressure to having gained weight or be admitted to hospital and having little support with improving his latch and expressing milk, I've had to top up with formula, which is something I have not wanted to do and did not need to do with my first child. And due to having no support since my baby was 2 weeks old, I've had to adapt our feeding to allow for her possible tongue tie. I cannot even get a diagnosis due to the current situation. It's been a hard slog and I've been in immense pain. And my mother is wonderful and a huge supporter of breastfeeding. I was really looking forward to her coming to visit after my baby was here. She cannot come, and whilst we can video message, it's just not the same as having your mum close by. I feel I need her, not just to help, but emotionally, and I'm struggling without this support. It makes everything feel so much harder. We also found that there were really significant differences in who had a positive experience and who had a negative experience. And I remember talking about this as we were collecting the data almost a year ago now, around the fact that what seemed to be occurring was that those mothers who had a positive experience and positive reinforcements in their life around breastfeeding anyway, tended to have an even better experience, whereas mothers who were already in a situation that was challenging tended to have a much worse experience. So it was things like whether they had high-speed Wi-Fi or not, or their own device. So it's one thing to be sat at home with your high-speed Wi-Fi on your lovely big monitor or iPad, talking to somebody and getting the support you need. When you're on a pay-as-you-go contract, or using trying to get the mobile data working and on a tiny little phone trying to talk to somebody, then that's going to be a completely different experience. Wider living circumstances also mattered. So this is something I found really interesting, and I think I use the word interesting in the wrong way sometimes, devastating as well as interesting, was that where mothers lived and their experiences of living through the pandemic really seemed to affect their breastfeeding experience. So those who lived in an area with lots of green space, who could go for a nice walk in green friendly areas, who had lots of space in their house, who had their own private garden, had a much better experience in general during lockdown, and that seemed to impact on their ability to breastfeed because it allowed them that escape and that opportunity and that space and that time. Those who were living in areas where they didn't feel safe going for a walk, or didn't want to go walking around a built-up area again, or were struggling for space at home, were the ones who are finding it really, really challenging. One indicator we found that if you lived in a flat and you lived on a higher up floor, so you just had a balcony or even no balcony, then that was an indicator of finding it really tough, because of course you haven't got the space in a situation like lockdown, which makes everything far more stressful. It makes relationships at home more stressful, and that all impacts onto breastfeeding. We also found that mothers from Black, Asian and minority ethnic backgrounds struggled far more, and they stopped breastfeeding at a far higher rate than mothers from white backgrounds. And one reason when we asked was that they were more likely to stop because they didn't have access to the same level of professional support. Something happened in terms of support access here. And it's a particularly challenging statistic because we know that from infant feeding survey data in the UK, mothers from BAME backgrounds do have higher initiation and continuation rates. So for them to have an even worse experience just showed the significant impact here of the pandemic upon them. And it's something that I really hope that someone will take forward in really exploring further, because we really need to know what happened and what we can now do about it. So some of the questions going forward from this, how do we ensure better promotion of availability of online breastfeeding support so that families know they can access it in all circumstances? I'm going to pop some of the breastfeeding support line numbers up in a bit, but it's about, we know the support is out there, but we know that women and families aren't accessing it in equal ways. Families who know about it, families who are able to better access and feel more confident in accessing it, did access it, and they had far better support. And then how do we ensure these organisations are well funded to be able to meet the needs of more women? Breastfeeding charities stepped up so much during the pandemic. They took all their support and turned it into an online version. They had online peer support groups. They had people answering calls and doing video conferencing, you know, to such a high extent. They're charities. They have some funding, yes, but how do we make sure that they're properly funded to do this? And how do we enable all populations to access online support, including those who may not be able to afford technology or high-speed internet connections? I know I've said this before, but I think one of the best things we could do in supporting families was, as for pregnant families and new families, is to give them free high-speed access to the internet and an iPad. And I think we'd go a very long way in bridging that gap between those who can afford to live in a digital world as such and those who can't. And then for me, how do we ensure those who have stopped breastfeeding before they're ready are supported? I think as we're coming out of this, hopefully, we're going to start looking around and realizing the number of women who had challenging experiences and the lasting challenges and grief they may be experiencing from that. There are women perhaps who are mixed feeding and weren't wanting to, and how we can maybe support them to build their supply better now they can have more face-to-face support. How we can basically try and pick these women up. There's a lot of talk about investing in babies and children going forward, but I'm really thinking about how we can try and make this better to some extent for mothers who have been harmed by this. And just to finish off, a reminder, if you are a breastfeeding mum, if you're supporting someone who is breastfeeding, there is support out there. Talking to your midwife, talking to your health visitor, but also just a reminder of these free charity helplines that you can ring. And if you go to their websites as well, many have chat or email contact now. If you're looking for more specialist support and want to work with a lactation consultant, the website there, LCGB, so Lactation Consultants Great Britain, has a little tool on it, so you can find some specialist support in your area. And as always, the breastfeeding network there have very detailed information, and you can contact a specialist pharmacist if you have been prescribed a medication or a procedure in any way and you want some information about whether it's compatible with breastfeeding or not, particularly if you've received information that something you have been prescribed isn't safe. Please always check with them, because there has been an issue and continues to be an issue sometimes with people being prescribed medications and told that they can't breastfeed when actually it would be safe for them to continue. So thank you. And I think I'm actually on time for once.
Fantastic. That was superb. That was really, you packed a lot in. Sorry about the 9 books. I should have known, because I was thinking as I was saying, I'm sure there's more than that.
Look, behind me, you can tell.
They're beautiful and so shiny and beautiful. Thank you, Amy. That was lovely. I mean, you answered one of the questions I had, which was how can we level up by the free broadband and iPad idea. But I was wondering, because there were some aspects that you were talking about that were quite positive for women and families. How can we keep those things that we gained during COVID over there? Because everyone's very full of this Freedom Day and all going back to normal. But of course there are, well, whatever normal's going to be, the new normal. But there are some things that we got out of last year that might be useful. And it feels to me as though there were some things from a breastfeeding mum point of view.
Yeah, I mean, I think it's going to be different for every family, but I think it was the focus, at least for some, on being able to rest and recover after birth and the expectation that they didn't have to go out places. And I think we need more awareness and value of that we should be supporting mothers and helping them rest and recover after birth. And we should be giving them at least some of the peace and the quiet that they need to do that. And we should be looking after them. And of course, that's going to be different for every single family. Some might really value visitors being there day in, day out and thrive from that. But I think a lot feel this pressure to get out and about and show that they've recovered. There's a weird kind of value in it that we almost have in our society of the mother who's out and about 2 days after having a baby. You know, she's super mum, she's doing it all. And it's like, no, we should be looking after her, not forcing her to be out and about.
Absolutely. I think some cultures have got it very right, haven't they? I mean, I know that some midwives will say to women, you know, don't get dressed for a few days, because otherwise I don't mean walk about with no clothes on, I mean keep your dressing gown on and everything, because, you know, people come round and they expect the new mum to be making tea and cakes and all sorts, whereas everybody should be making her tea and cakes. So that's a great point.
It's visiting the new mother rather than visiting the new baby.
Yeah, absolutely. That's fabulous. Thank you. Now I have a question from Laura Bailey. Not sure, this might be quite a tricky one. Thank you, Laura. Hi Amy, you said the vaccine is safe for breastfeeding mums. Does this mean that the baby's toddlers will not suffer the side effects of the vaccine that people are having? Also, should we recommend one vaccine over another? Thank you.
That the recommending one over another is not my area of expertise. If you go and have a look at the Breastfeeding Network website, there is so much information on there that might help you with some of those questions. I'm not quite sure what you mean about the suffering side effects. Do you maybe mean in terms of a baby or a toddler being vaccinated in the future? I'm not sure. I would say, you know, I am not a vaccine specialist. Go to that website. There is so much information on there. I've directed so many people to it because it's really collated everything we know about this, and so much different sources of information on there for you to have a look at.
Absolutely. And also, if you have a look at the Royal College of Midwives information hub on COVID, there is guidance, up-to-date guidance on vaccine, so you might find it useful to go to there, Laura, just to update. So thank you for that, Amy. Another question from Vicky Stokes. Hi. How can I as a student reassure the women and indeed encourage them to have the vaccine? I've had so many asking what to do. It's another vaccine question. We do have
it is a really tricky one, and what I've been doing is sending everybody to the Breastfeeding Network website if they've had a sudden influx of traffic and are wondering what's going on, just because it is so reassuring that there are lots of different sources there. So it's about talking through that we know that there is no logical reason why it would harm a baby in any way. We know that when a mother is then making antibodies, that those are likely to be passed to her baby as well through her milk. I think if we can talk about breast milk in that way as a means of protecting babies through its content, through the antibodies, and I think that's a really powerful message. But sorry, Breastfeeding Network, if I crash your website, but I would again, it is really good. There's so much reassuring information on there. So I would have a look at that with her, or direct her to it. You might find it useful to go and read as well, so that you can pass on some of the information in a summary.
That's fantastic. Thank you for that. So thinking about the research you did, what's going to be the next stage of it, do you think? Having done that mega piece of work last year, I bet you've got more ideas for future research now.
We are wanting to do something around the communication experiences around all of this, around the safety, and then communication around the vaccine as well, because there have been so many scary stories in the media and all the kind of chaos of women being told that it wasn't safe for them to have the vaccine, not because it wasn't safe, but because nobody had really looked at it and considered, you know, all these breastfeeding women would actually maybe want to be vaccinated. I'd like to go back and look at some of those long-term experiences. It would be great to, thinking back to your point earlier around what have we learned from all of this, and thinking about that, what have we learned? What can we take forward?
Yeah, because I was quite, I mean, this is in a way, what's sad is it's unsurprising when you were talking about the BAME breastfeeding mums, you know, those women who are already disadvantaged or living in very poor situations. Think about how we can, and I know this is a terrible phrase, level up, or make sure that the services and support these women get is better. We're getting something wrong still, and we need to really, I know there was a pandemic on, and probably that made it difficult to get to everybody, but I'm not sure that's an excuse, really.
No, the finding around women from BAME communities not being able to access professional support in the same way is stark. It's there. It's saying, you know, they couldn't access it, or they didn't feel supported by it, whichever one it is. And I think that needs looking into about why. I mean, so many women struggled with accessing support because it was all new and it was all scary. But why? What happened? Why wasn't it, you know, a suitable form of, why wasn't support being given?
We can start with the free broadband and the iPads, I suppose, for that point of view. But it may be that Binish and Hannah might add to that at a later point. But in the meantime, thank you so much, Amy. That's been fantastic. And just note all the books on Amy's bookshelf. And I can thoroughly recommend any of her books because they are very accessible and really a little bit challenging in parts, but also very, very supportive for midwives and for women who are breastfeeding, actually. I think a lot of students would find them useful also from that point of view, wouldn't they? Yes.
Yeah, everybody.
Everybody and anybody.
Needs all 9. Yeah.
So very many thanks, Amy, for making time to be with us.